Hello everyone. Today's video is a little case report about a successful treatment using high-dose sulfur therapy. I posted a video about high-dose sulfur therapy, which is basically using high doses of MSM, which is methyl sulfonyl-methane. I posted that video within the last week or two, so please check that out for reference for like, what the heck am I talking about with high-dose sulfur therapy? Just before jumping into the video, as per usual, nothing I'm saying should be construed as medical advice. This is for informational purposes only. If you need medical advice, please talk to your healthcare provider to get that advice. And if you wouldn't mind at some point taking a quick moment to please like, share, subscribe, and or post a quick comment on the video, I'd really appreciate it. So thanks in advance for taking a second to do that. So this little clinical story here is one of the growing reasons, one of the many reasons why I'm really developing a love for MSM, this high-dose sulfur therapy. As I mentioned in the other video, I learned about this several months ago from another naturopathic doctor, Dr. Kathleen Janelle. I interviewed Dr. Janelle on my podcast a week or two ago. I haven't posted the episode yet, but please stay tuned for that on my Overcoming Chronic Illness podcast. And so this patient that I'm referring to, we had been working together for a good couple of years or so. Chronic digestive issues, a lot of nausea, a lot of headaches, a lot of gas and bloating, bowel irregularities, some joint pain, and we tried virtually everything. She's a very, very good sport, and did all the tests, all the treatments I asked her to, and we just really were coming up empty-handed. She tried the carnivore diet. She tried prior to that a modified ketogenic diet, paleo diet. No difference at all with symptoms. We tested for SIBO, tested positive for SIBO, treated for SIBO, no difference. Retested, SIBO is gone, still has the symptoms. Tested for LIBO, which is large intestine bacterial overgrowth. Came up with evidence suggesting LIBO, treated for that using several different methods. Didn't make a difference with any of the symptoms. Retested, symptoms, LIBO is gone, no change in symptoms. We ended up doing a stool test to look for at her elastase levels to see if there's maybe some degree of exocrine pancreatic insufficiency. Elastase levels were low, treated with pancreatin, tried different dosages, made very minor differences with bloating, no lasting changes, so really no difference with that one either. Tried ox bile, tried digestive bitters, tried betaine hydrochloride, stomach acid replenishment, tried ox bile. We just really tried an anti-parasitic protocol with mimosa pudica and high doses of wormwood and black walnut grapefruit seed extract and some other anti-parasitic herbs. We just tried so many different treatments for this poor woman, and just nothing was really making a difference. Tried biofilm disruptors, just nothing made a difference for her. And so thankfully she's very patient, and she was putting up with my utter lack of ability to help her feel better. So it was a very rare case in my practice where we just weren't seeing traction with anything. We took so many attempts at bat, so to speak, coming up empty-handed. So as the fates would conspire, probably right around the time we were kind of running out of options because we tried everything. Thankfully, I heard about this therapy. I tried it with a few patients. I was seeing improvements with it. I said, would you please try this? And being the good sport that she is, she said, sure, I'll give this a try too. And so we started the treatment. She built up pretty slowly, and we had a follow-up, and she came back and said, I'm starting to see some improvements, not quite as much nausea, some bloating reduction. Still wasn't on the full dose. I was like, okay, cautiously optimistic. We're actually seeing the needle moving here. So followed up again a couple months later. She's building up the dose really slowly. She sometimes reacted to things, life gets busy, whatnot. But anyway, saw her again. She was on the full dose, or at least on a very, very robust dose at that point, and things were doing markedly better. Nausea and headaches markedly reduced, bloating way down, bowel regularity doing better, joints feeling better, and I was just so happy for her because she had just hung in there for a really long time. Again, she was such a good sport with everything, and just so gratifying to see those symptoms improving. And so I was very, very happy to see that. And I've been around the block enough times. I've had some patients where we are seeing positive results, and then it just doesn't last. We kind of see this. I don't know if it's a placebo effect or if it's just, we're just not quite hitting the nail on the head. The body needs something more. So, we had that follow-up, and I was, encouraged, but I was like, okay, great, we'll stay the course, give it some more time. But, I was not quite ready to post a celebratory video like the one I'm posting right now, or not, quite ready to start, preaching it from the rooftops. But then we had another follow-up a couple months later, she's still doing better. She's, seeing further improvements with things. And it's like, okay, I'm pretty sure this is legitimate in this case. So, and also by that time I'd seen that many more other cases that had improved or are in the process of improving, and I'm just gaining more and more confidence with this high dose sulfur therapy. So I'm infinitely grateful to Dr. Kathleen Janelle for putting this information out there. I'd never heard of this before. I'm glad that she's lecturing about this now, because I go to as many conferences as I possibly can. I look into all the different therapies that I can, and I just had never come across this before. And so I'm really thankful that she started teaching this, and I was able to learn from her, and that it's been helping my patients. So I have a couple of other really good stories akin to this one as well, like just really tough cases, really not getting traction with other things we were working with, but I'll save those for another day. Over and above those, I would say very, very exciting stories. I have another number of other patients that are doing better with the high dose sulfur protocol as well. I've really started implementing it a lot sooner. I'm not just waiting for like everything else to fail or the patient to like plateau before we try this. It's gone from, I don't want to quite say Hail Mary pass, but it's kind of gone from Hail Mary pass to like much sooner in my algorithm, my mental algorithm, in terms of what I'm going to recommend for folks. Whenever now I'm thinking of, I want some gut healing, I want some antimicrobial support, there's some joint stuff going on, some allergy stuff going on, some hair, skin, or nail stuff going on. I want an anti-inflammatory effect. It's like, man, sulfur just hits on all of these targets. So I'm really, really excited about it. And I just plan to keep on using it in practice because it's been working so well. So if you're listening to this video and you've tried high dose sulfur, which is MSM at much higher dosages than one would typically take, which would typically be 1,000 to 2,000 milligrams a day, so much higher doses than that. If you've tried this and it's been helpful or not helpful, or any comments to share on that, please consider posting in the comment section below. If you have any questions on this topic or anything else, again, post in the comment section below, and I will do my best to answer as soon as I can.